After years of economic decline, Manchester, New Hampshire has made enormous progress. Old textile mills and rail lines have been converted into high-tech hubs and welcoming public spaces. But the city struggles with high rates of crime, poverty, and an unprecedented epidemic of opioid abuse. To meet these challenges, Manchester is drawing on one of its greatest strengths, the community bonds that have always defined this city.
We finally got it. We finally realized that in order to measurably improve the health of a whole population, we had to engage everybody in the community.
The Neighborhood Health Improvement Strategy is a comprehensive community initiative led by our public health department. It has stakeholders at the table from the business sector, the nonprofit sector, the public policy sector. It has all the right people coming together.
Schools have a really unique opportunity to play a pivotal role in health of a neighborhood.
We identified 2 local elementary schools as being the epicenter of the Neighborhood Health Improvement Strategy. We directed a tremendous amount of resources to make sure that people feel really comfortable seeing the school as the center of their neighborhood.
We bring flu clinics here, we bring block parties here, we bring health fairs, so there's this connection between the school and the families that hasn't been there before, and so we're building bridges.
The more that we can get to where somebody lives and the influences in their daily life, the better we are seeing results across the spectrum of health outcomes.
Making sure that a family has safe, decent, affordable housing is a must. And to be able to link up with other service providers, to be able to combat some of the same issues, but coming at it from different angles, it really made all the sense in the world.
The biggest challenge that Manchester's facing right now is the heroin crisis. It's the drug addiction.
That are overdosing in the streets. They're overdosing while driving cars.
The city of Manchester is approaching the opioid epidemic by using a wholesale, all-hands-on-deck community approach.
We were able to enact a program called Safe Station, where we opened up the firehouses in the city so people could go and get connected to treatment and recovery when they needed it.
The way it works is so successful that we've had other communities contact us about how they could open their own Safe Station program.
A healthy economy needs to have a healthy community. You've seen our business community be front and center at the table, engaging with the neighborhood community health initiative. We all share the same belief that we have a special opportunity here to make our city healthier, safer, and more attractive for the current generation and the next generation.
Manchester's a great city, and Manchester, by virtue of being in New Hampshire, is seen very differently. So we had to think very differently. So when we began to realize that we had some real challenges in the community, we were up to 57% of our children on free and reduced lunch in the schools, high rates of overdosing on opioids. We began to look at it very, very differently. So we implemented a grassroots to grass tops strategy, which really began the implementation and development of the Neighborhood Health Improvement Strategy, which was our blueprint, which is what we were missing. So by getting everyone engaged in the Neighborhood Health Improvement Strategy, we were able to really begin a block-by-block neighborhood approach to improving health. We realized we had to do things differently. We had the document, we had the strategy, and we got the players around the table and said, how do we get further upstream to change the culture of health in our community?
And I know part of that was how you reallocated resources, and that was challenging, wasn't it? And we'd love to hear more about that.
So it was very challenging. As Tim said, we needed a blueprint, we needed a roadmap for how we could work together and focus on the common good in our city. As the city's largest private funder, we knew that we were not getting the results that we wanted for the millions of dollars that we were investing every year. And we had to have some really tough conversations about what happens when you're spending millions of dollars, but your neighborhood outcomes are going in the wrong direction. So the first thing we had to do as a funder was we had to be courageous and say we are willing to allocate a significant, in our case 60% of all the funds we had available to this plan and really change the way we historically did things.
And one of the things I saw in Manchester was United Way did that, but so many other people, your Chamber of Commerce leader, other foundation leaders, your not-for-profit sector, your education system, all rising to say we're part of this plan. How'd you create that momentum?
Yeah, certainly to Patrick's credit in Granite United Way, we really began to look at a collective impact model around funding. And people needed to understand that the way we were doing things wasn't working and we needed to change. So we began to implement programs like community schools, where we brought programming into neighborhoods. As you know, Lori Upham says in the video, we built bridges with families. And once we did that, we were able to engage the community at a much different level. You know, the resident voice is such an important piece of what we do, and we need to make sure we understand the needs of the residents. And it's not a top-down approach, but rather we're getting all of those segments of the strategy, business, nonprofits, government, around the table to say we're going to do it differently.
So let me jump in and ask a question about how you sustain this. You've clearly made tremendous progress. You've got a blueprint. People are working together. Sustaining it over maybe 40 years, maybe what you have to do. What kind of assets, financial, relationships, whatever you want to mention, are you thinking about now to keep this going?
Well, I think sustainability, especially to a funder, is something that we always ask ourselves about. We are doing some systems change work now. You saw our reaction to the opioid crisis in our state. We knew that if private sources like United Way and corporate funded that initiative out of the gate, that we could advocate at the state capital level for changes at the local level and state funding. So now, 6 months into that project, the burden isn't on the local economy as much as it is coming from the state. So a lot of advocacy and a lot of forward thinking.
I would just add, I think when you show results, we've had a conversation earlier in the day about metrics. What are your metrics going to look like? And when you get to use tools like Promise Scorecard to show as a community where you are, it's going to make that sustainability piece much easier because we're going to be able to demonstrate results.
I would add Reese's question earlier. You've got a tremendous group of partners. You've got business at the table, local funders. Is there anybody that's not there that you wish was, or you have a goal to try to bring somebody else in?
I would suggest we can always do a better job at getting more residents around the table. I think early on we've struggled with resident engagement. I think through things like community schools, safe stations, we've been able to build bridges and create new levels of trust with the community, and that will help us get new residents around the table.
I would only add that we really are continuing to work in engaging the business community, and it was said earlier that good health is good business, and we want our local business owners and our business leadership to see how important this is to their own fortunes.